Absence seizures are brief, sudden lapses of consciousness that occur more frequently in children than in adults. During an episode, a person may stare blankly into space for a few seconds before quickly regaining alertness. While these seizures typically do not cause physical injury, they can be dangerous in situations like driving or cycling. Fortunately, absence seizures can usually be controlled with anti-seizure medications. Some children who experience these seizures may later develop other types, such as generalized tonic-clonic or myoclonic seizures. Many outgrow them during adolescence. A simple absence seizure often presents as a vacant stare, which can be mistaken for a brief lapse in attention. The episodes typically last around 10 seconds, though they can extend up to 30 seconds. Unlike other types of seizures, absence seizures do not cause confusion, headaches, or drowsiness afterward. Some noticeable behaviors during an episode may include lip smacking, eyelid fluttering, chewing motions, finger rubbing, or small hand movements. Despite these signs, the person usually has no memory of the event. However, if a seizure lasts longer, they might become aware of missing time. In cases where seizures occur frequently throughout the day, they can interfere with school or daily activities. Children may have absence seizures for some time before an adult notices, as the episodes are so brief. A decline in academic performance might be the first indicator, with teachers often observing difficulties in attention or frequent daydreaming. Parents should consult a pediatrician if they suspect their child is experiencing absence seizures, if their child with epilepsy develops new seizure symptoms, or if the seizures persist despite medication. Immediate medical attention is necessary in cases where a person experiences prolonged automatic behaviors lasting minutes to hours, such as eating or moving without awareness, or showing signs of prolonged confusion. These could indicate a condition called status epilepticus. Emergency services should also be contacted if a seizure lasts longer than 5 minutes. Absence seizures are generally linked to genetic factors. Seizures occur due to abnormal electrical impulses in the brain's neurons, which disrupt normal communication through repeated electrical patterns. Additionally, neurotransmitter imbalances may contribute to seizure activity. Several risk factors increase the likelihood of absence seizures. They most commonly occur in children between the ages of 4 and 14 and are more frequent in females. A family history of seizures is another significant factor, with nearly a quarter of affected children having a close relative who also experiences seizures. While many children outgrow absence seizures, some require lifelong medication. Others may eventually develop full convulsions, such as generalized tonic-clonic seizures. Additional challenges can include difficulties with learning, behavioral issues, social isolation, and an increased risk of injury during a seizure. A detailed medical history and physical examination help confirm a diagnosis. Doctors may use an electroencephalography test to measure electrical activity in the brain. Hyperventilation during an EEG can sometimes trigger a seizure, revealing distinct electrical patterns associated with absence seizures. Brain imaging, such as MRI scans, may also be recommended to rule out other conditions like strokes or tumors. Because the procedure requires stillness for long periods, sedation may be necessary for younger children. Treatment typically begins with the lowest effective dose of anti-seizure medication, which is gradually adjusted if needed. Many children who remain seizure-free for 2 years can eventually discontinue medication under medical supervision. Commonly prescribed medications include ethosuximide, which is often the first choice due to its effectiveness. However, it may cause side effects such as nausea, vomiting, sleep disturbances, and hyperactivity. Valproic acid is used when absence seizures occur alongside tonic-clonic seizures. While effective, it has potential side effects such as weight gain, attention difficulties, and, in rare cases, liver failure or pancreas inflammation. Women who may become pregnant should discuss its risks with their doctor, as it has been linked to birth defects. Lamotrigine is another option with fewer side effects, although it may be less effective than ethosuximide or valproic acid. Possible side effects include rash and nausea. For some individuals, dietary therapy, such as the ketogenic diet, can help manage seizures. This high-fat, low-carbohydrate diet is generally reserved for cases where medications are ineffective. Less restrictive alternatives, like the glycemic index or modified Atkins diets, may also provide some benefit. Maintaining good lifestyle habits is crucial. It's important for children to take their prescribed medications consistently and get enough sleep, as sleep deprivation can trigger seizures. Wearing a medical alert bracelet ensures proper emergency treatment if a seizure occurs. Additionally, parents should discuss driving restrictions with their child's doctor, as seizure-free periods vary by state before someone with epilepsy can legally drive. Living with a seizure disorder can be stressful, but having a strong support system can make a difference. Families should educate themselves about the condition and openly communicate with children about their seizures. Teachers and school staff should also be informed so they can accommodate any necessary adjustments. Support groups, both in person and online, provide a space to share experiences and receive guidance from others facing similar challenges. Seeking help from family, friends, and medical professionals can ease the burden of managing a seizure disorder and improve overall well-being. Thanks for watching. If you enjoyed the video, give us a like, comment, and subscribe. And don't forget to click the bell icon to stay updated on the latest discoveries in health and medicine.